Gentlemen, dear colleagues, dear friends, it's wonderful to have you in this cozy room of the Maison de la Paix. I'd like to thank the Global Commission on Drug Policy for hosting us this afternoon for this second iteration of the So What series that the SDG Lab launched on 1st of June this year, to which some of you may have participated. I'm Nadia, I'm the director of the newly established SDG Lab, although I'm not sure how long I can say newly for, because we did start building this unit at the beginning of this year, and we're now mid-September. But I guess for a new initiative of such, I can still say that we're pretty new, and we're experimenting. And the So What series is definitely part of an experiment. And what we're doing today is basically looking to demystify and to break down what we actually mean by indivisibility of the goals of the SDGs. As you know, when the goals were adopted at the end of 2015, there were a few paradigm shifts, were there? One was universality of the goals, so that we're no longer speaking about a north-south divide, but basically acknowledging that we're all a developing country until we all reach every single target of the SDG agenda. The second paradigm shift is indivisibility of goals. And it sounds really, in theory, it sounds pretty easy to understand what it means, right? The linkages between goals. But what we've noticed at the SDG Lab, together with all of you, and when I say all of you, you represent a very diverse community, the broad Geneva ecosystem. So some of you come from governments, others come from civil society, other colleagues around in the room come from member states representations, NGOs, and all of you in some way or another have told us it is not that evident to understand what indivisibility actually means in practice, whether you're a policymaker or whether you're a practitioner. So the So What series is really an attempt to look at what that actually means in practice. And this afternoon I have here in the room a very diverse group of people who come both from, I'd say, the SDG3 world and the SDG16 world. Yet, although they all have their own expertise in one goal or the other, they, through their experience, have come to conclude that the only way forward for a sustainable response on any of the targets of SDG16 or SDG3 will happen only if we look at them through a common lens. So this is the reason we've invited these speakers here this afternoon. I'm very grateful for your presence. I'll have an opportunity to thank you personally afterwards. But let me just, before we start our conversation, let me just say a few words on the SDG Lab for those who are meeting us basically for the first time. So the SDG Lab is a multi-stakeholder team. We are composed of representatives of civil society organizations, representatives of missions, as well as UN staff and academia. So when I was asked to lead this team, I said I will lead it as long as it is a multi-stakeholder team. Otherwise, we're just preaching what we're not doing, right? And I think SDG 17, if we're going to really walk the talk of SDG 17, it's all about working together in a multi-stakeholder way. So our team is very much that. And every day we challenge each other because we come with our different entry points that are either based on our experience as former diplomats or coming from civil society or coming from academia. And when the SDG Lab was created, we basically tested a few assumptions based on a lot of bilaterals that we had with a lot of you in the room, actually, in terms of where can we add value? Where can we add value in the sense, can we avoid stepping on other people's toes and really galvanize all the great energy that exists in this city to demonstrate that we really are more than the sum of our parts in supporting the implementation of the SDGs? So we're a convener. Today, I guess, is one of the best examples of that. We convene around SDG questions about concrete operational questions at country level. We connect either informally or formally. So we either do it because people ask us to do it. For example, they are testing a new tool, a new policy, and they'd like to test it in a safe space with other stakeholders. These are the kind of connections we do. Or an NGO developing a new tool on how to better monitor the implementation at SDG level. We connect these people with our broader network so that whatever they're doing is multiplied. And we're an amplifier. Today is an example of how we can amplify experiences. It can be done through events, but it can be done in many ways. And this is actually a huge challenge we have, and we'd love to have your feedback as we grow and develop the SDG Lab. How can we better amplify those stories that are demonstrating impact at country level? We all know that that's what we're all striving for, right? We don't have these kind of events just for the pleasure of meeting all of you, although it's lovely to see you, but the reason why we're doing this is to influence country implementation. What is working, what is not working, this is what we need to all know and learn from each other. So how do we amplify? It's not enough just to put everything on a website and hope the right person reads it at the right time, right? We need other ways of amplifying things, and this is what the SDG Lab is looking into. And what are all these innovative tools that we can develop for better amplifying and sharing those experiences? We're a question asker. I guess this afternoon is also an example of a space where we want to ask questions. I'll be asking questions later to our panel, and sometimes provocative questions. It's been said actually by many, and actually even from colleagues in New York. I'm back from the UNGA week, where a lot of colleagues were saying, you know, these kind of questions you can ask in Geneva. They're more difficult to tackle in New York, but in Geneva you can. You know, what are the real incentives for governments, for ministries to rethink their governance models, to have a more integrated approach to the SDGs? It doesn't just happen. What are the drivers for them to do so? Those kind of questions. This is what we're interested in at the SDG Lab. And lastly, we're an innovator and an experimenter. I guess our team itself is an innovation. And the way we do business, we try, for example, to be very oral communication based. So I challenged my team saying, let's not have a single report coming out of the SDG Lab. Okay, let's make sure we give voice and feet and magnify the voice of other people's work and great documents, but let's not us create another piece of work, right? So these are the kind of things that we're working with. So today is all about crossing goal SDG3 on good health and well-being together with SDG16 on peace, justice, and strong institutions. And the objective of this event actually is very simple. If you all come out of this room thinking, I had never thought of that, then for us, we've completed our objective of the day. This is exactly what we want people to see, understand in practice through examples. This is what we mean by indivisibility. And this is why it may be pertinent in my own sphere of work to look out of my comfort zone and see whether there are connections with other SDGs. We also want to demonstrate that in practice, right? So I will be nudging our colleagues here in the room to really show through their great experience where they have had a benefit in crossing both those goals and where the outcome would have been different had they not done so. And last but not least, through this event, we really want to kickstart an exchange on crossing these two goals. I'm sure in the room, many of you have experience on crossing those two goals and won't have an opportunity to share in depth your experiences in that regard. But at the SDG Lab, what we suggest is that we continue the conversation afterward through our convening, our connecting, our amplifying work to really make sure that we can share these experiences with other partners. Just a small slide to tell you, first of all, that we're live streamed, so whoever's online, hello. Please don't hesitate to tweet. The hashtag is there. I've also put on the slide our website as well as our email so that you have that information. And don't hesitate to contact us after the event using any of these instruments. So, if I may, I would first like to give the floor to Dr. Kazachkin of the Global Commission on Drug Policy, who's had the kindness together with his team to host us this afternoon, for a few introductory remarks before we kickstart the conversation with our panel. Michel.
Thank you, Nadia. Can you hear me? Yep, thank you. Not really introductory remarks, but just a few words to introduce the Global Commission on Drug Policy to those of you who wouldn't know about the Commission. Let me say from the start, it's a pleasure for us as the Global Commission to co-host this event. drugs and drug policy is very much at the intersect of SDG3 and SDG16, or using your language, a very concrete example of the indivisibility of these objectives. I'm introducing the Commission. I'm a member of the Commission, and I'm introducing the Commission from a formal perspective because our chair, the chair of the Commission, Ruth Dreifuss, is today a panelist on this event. The Commission is not an official UN commission. It's a group of people, we call ourselves citizens of the world, that came together in 2010 to advocate for drug policy reform, for more health-based and human rights-based approaches to drug policy. Under the leadership, originally, of Fernando Henrique Cardoso, the former president of Brazil, and the former chair of the Latin Commission on Drugs. The Commission comprises 23 members, of whom 12 or so are former heads of states or government, and otherwise people, it includes personalities from the human rights, the health sectors, the private sector, government sector, cultural sector, again coming together with the same passion for trying to move drug policy reform as an example of what an open society can be. The Commission publishes reports. We've published a report basically every year since 2010. I believe these reports have impacted the field and the way people think about drug policy. It certainly has influenced some of the major events, such as UNGAS 2016, although, as we were discussing with His Excellency, the ambassador from Mexico, there are now strong winds, blowing against some of these ideas. But here we are. Our latest report, published a little less than a year ago on decriminalization of drug use, calls for a ban, a lift on all penalties, both criminal and civil, for drug possession for personal use. So this is just a little, ahead, more than just decriminalization, that is removing penalties from the criminal justice system. So that's this short introduction. Back to you, Nadia, and to the panel.
Thank you very much. Thank you very much, Michel. Indeed, that's a very concrete example of where those two goals interconnect and intersect. And we'll be hearing a lot more about drug policies in this panel. And more broadly, we'll be looking also at other health-related issues, so the expertise of AIDS around the table, TB, and other matters. I'd like to kickstart the conversation with you, Madam Dreifuss, if I may. You currently serve as the chair of the Global Commission on Drug Policy. You're a former Minister of Home Affairs in charge of health, where you undertook some very important policies that were very new at the time, be it in the fields of drug addiction and prevention of HIV. You were very much a leader in that regard. You also worked on the new law to guarantee universal health coverage for the entire Swiss population. And not least as a former president of Switzerland. It's such a pleasure to have you here this afternoon. And I know quite a lot of your background and experience, having followed you and admired you for many, many years. And I know you're very well positioned to tell us more about what are the incentives, basically, for policymakers and practitioners to intersect Goal 3, so health-related issues, and Goal 16 in their analysis and strategies to reach sustainable responses.
Well, thank you. Thank you so much. Is it working?
Yes.
No? Yes? Is it now working?
I think this one may work better. Try this one. There you go.
Parce qu'il y a un bouton.
There.
Okay, so this is working. Well, I am coming, as Nadia told before, just before, I am coming more from the health perspective, because I was in charge of the federal health policy in Switzerland at the peak of the AIDS epidemic, and at the peak also of an overdoses epidemic and the great misery of drug users at this time. So this is my experience, and when I read the goals on health, I find a lot of relation to the work I did in that time, and I continue to do as not only the chair of the Global Commission on Drug Policy, but also twice as chair and co-chair of two commissions on the access to medicine and innovation in the medical field. So this is my background, my experience. But the link with, and I find a lot of things in the SDG3 linked with drug policy. There is just one sentence on drug policy. It's an interesting sentence because it makes the link with abuse of substance, psychoactive substance, but it speaks in the meantime about alcohol and drug. So it shows the health problem being more or less the same from the point of view of the risk of addiction, but not the same when you consider all the harms that drug consumption is linked with through the drug policy and the necessity in most countries to consume drugs in prohibitionist policy and atmosphere, and we can speak more about that later on if there is a need to. But in this SDG3, we find a lot of things. I mean, linked with drugs, HIV, access to medicine, to controlled medicine like morphine and so on, so that drug policy is going through the whole, I would say, SDG3. But now the relationship with SDG16 is, if I can say so, around the word justice. What does that mean, justice? On one side, it is a general aim for humanity to be just, but it is also a very practical way to decide about laws, their implementation, and what happens to the people who are breaking these laws. And you know, my friend Badinter, former Minister of Justice in France, the real author of the abolition of death penalty in France, often says there are many, many crimes made in the name of justice. There are many situations where people are, through the laws, put in situations where their rights are not really respected. And if I take now the drug policy, this is one of the fields where the contradiction between justice, not the ideal of justice, but the real justice, how it is written and implemented, and the reality of drug users, and the reality also of the petty criminals, for instance, in the drug chain, are violated by these laws. And if I could take many, many of the SDG 16 to show that there is not only terrible consequences of the criminalization of the drug users, putting them in underground, in unsafe consumption, provoking the spread of transmissible disease, having really also consequences of their human rights in society that are in contradiction with the SDG 16. Mm-hmm. And in this sense, I would say it is very important to overcome this contradiction between the ideal of justice, the reality of the law and the implementation of the laws, and drug policy.
Mm-hmm. Wonderful. Thank you very much. I think those examples really speak for themselves. Ambassador Lomónaco, from a government perspective and representing the government of Mexico here this afternoon, thank you very much for being here. Could you tell us a little bit more about Mexico's experience in policy making, either under the SDG era or prior to the SDG era, where you were actually brought to looking at SDG16 and SDG3, whether they were called that way or not at the time, to have a response that actually brought the outcomes you desired? Could you elaborate a bit? Thank you.
Sure, but let me spend 1 minute
Please.
in introducing the subject and touching upon a couple of things. First, Geneva Gender Champions must be proud of this panel. And I'm honored, and I'm really honored to be the one that makes sure that there's a balance. Particularly because I'm the only one in this panel who's neither an expert on goal 3 nor on goal 16. Everybody else here is an expert. Number 2, and it goes to the interconnectivity or indivisibility that you mentioned. I strongly welcome the establishment of the SDG Lab. It's a typical Geneva response, and I'm very proud of it. And it is higher and bolder than anything that can be done in New York. Because, of course, the SDGs are about implementation. The main task is upon us, governments. But we need to make sure that there is this interconnectivity and consistency within the system, the UN system and the multiple stakeholders. And the SDG Lab provides a platform for that. Also for the really able work that as diplomats we do, which allows for different interpretations. I heard you, Madame Dreifuss, and how you interpret the last bit of goal number 3, and I'm sure many people can read many different things from that. And that's a beauty. We are paid for to do that as diplomats. But we need to make sure that there's consistency and that we understand each other, particularly when we interconnect the goals. Also, let me say that this is the last time I had the honor of sharing a panel with Madame Dreifuss on drug policy. I was representing a country which was in transition on its position toward drug policy. Now we are much more committed, I would say, at the forefront on pushing for a change. 3 years ago, we were not there. And this is to illustrate how fluid can this difficult topic be. I'm really proud that we are on the right side of history now. Personally, I'm much more closer to where we are than where we were. And I'm looking forward to discussing all these issues on this. To your question, I can give you a few examples of how we are linking the two goals. But I have to say that you could have identified other examples because all goals are interconnected. Absolutely. And should be interconnected. And this is why we have responded in general by establishing a commission at the President's office so it has the power and the teeth over the different ministries so that all the different stakeholders in the government, plus the legislative and non-state actors and academia, have a place to interconnect and make sure that we do implement those goals in an interconnected, consistent way. Now, specifically on these 3 to 16, I think it's very hard to argue that unless you have peace and strong institutions, it's very difficult to have a healthy environment and to provide for good policies and sound policies and implementation and accountability. This is what Goal 16 is about. And if you don't have a stable, sound, peaceful and strong institutional environment in which to operate, you start poking holes on your health policies. We have a campaign to ensure birth registration, essential for this is identity, but it's driven by a health perspective. We also have health and education systems, health in school. Again, you start with family, but then you go to school. And unless you have schools, and now that we are recovering from the last batch of earthquakes, we see how important schools are, as hospitals are. And so you need to have the connection between health and education in schools. And of course, on drug policy, which seems to be the subject at hand this afternoon. And I welcome that. We also have a program related to health and drug, where, of course, the human rights perspective is at the center of the policy.
Wonderful. Thank you so much, Ambassador, for your kind words of support. First of all, and also for giving those examples of where Goal 16, looking through the lens of Goal 16, you can have more sustainable health outcomes also. Thank you also for giving the example of your government in terms of looking at a whole of government approach, and it looks as though your government really has been a spearheader in that regard, and that's maybe for another conversation, or maybe we could invite you to the SDG studio so you explain to us a little bit more what were the incentives of your government to go through that process, because it doesn't just happen, right? There needs to be drivers for government to go through those difficult times. It's change management, isn't it? So why would you do so? So we'd love to hear you maybe on another occasion. Mariangela, it's wonderful to have you this afternoon. Mariangela Simão, Dr. Mariangela Simão is Director of Rights, Gender, Prevention and Community Mobilization. It's a department within UNAIDS. Mariangela, through your wide experience both in the Ministry of Health of Brazil, your wide experience also with the UN, and also as a practitioner. You're a pediatrician by training.
Once upon a time.
Once upon a time, but I'm told that once a doctor, always a doctor. Could you tell us also about, in the AIDS response, first of all, I mean, it's obvious for some of us in the room that there are a direct correlation between 16 and 3. Maybe you could elaborate on that. And then also focus on the challenges of doing so. There again, it doesn't just happen. So what are the policy challenges to convince governments to have such an approach for better health outcomes?
Lots of questions in one.
Of course.
But I was thinking while the ambassador and Ms. Dreifuss were talking about something that always comes back to my mind when we see these frameworks, these agreements that the UN has, which is actually reflects the consensus possible, right? So it's not everything that we want, but it's what was possible to agree upon. And when I saw your question, how do you link 3 and 16, and I thought, I remembered an intellectual from public health in Brazil when, long time ago, but he used to say, that the population has problems. People have problems, right? And then the organizations get organized and create silos or programs that when they are finalized, many times they don't have a connection to the problems themselves, right? So I think we create some things that don't help the life of the person out there who is who we were trying to reach. I'm trying to say that if we explain correctly, if you turn the SDGs into language that people can understand, it makes sense in real life. Because like you're saying, it's a no-brainer that a peaceful society is better for health. You don't have to be a specialist in social determinants of health to know that. But then we create a debate. For example, when I was reading a little bit before I came here, I was reading a little bit about the debate that was going around the SDGs and so on. And then we create, but the social determinants of health, like Sir Marmot described, does include the rule of law, so it's not, But actually, without the rule of law, you can't achieve many of the better health outcomes that we all want with the SDGs. So I would say that 3 and 16 are a no-brainer, like 4 and 5, and they have to make sense in people's life, and they do make sense. That's one thing. The other thing is thinking about, about what does it take to make the changes, right? And then I'd like to refer to our language here, Spanish and Portuguese, right? Because we have one word. We don't have a separation between politics and policies, right? It's politica means both. You can't have good policies if you don't do good politics. So we need to make this work in a less artificial way. We need to make this work for the constituencies we serve, and to end AIDS, and to end TB, and to end any disease that's preventable, and so on, or to promote better health outcomes for people who use drugs, and so on. So in a way, I think on the HIV, what we learned, and I collectively, I was just talking to Eleni on the way here. I've been working with HIV the last 13 years, but I have a long career in public health. I think one of the things that we learned is that you have several examples where you don't get your access to health or access to medicines, right? Which sounds good. Because of HIV, it became much more of a concrete global agenda, right? It became, the intellectual property came much more under discussion. Sexuality came to be discussed at the UN. We're just right now fighting like hell to get a new comprehensive sexuality education guidelines out, a revised version, because there's a... So I think there are several things that HIV brought to the table. But I on the 3 and 16, I'd like to cite a few examples. When I was trying to think today of what are the good examples that we have, and I could only think of the bad examples, where the rule of law actually serves to oppress people. Where you have right now in Tanzania a situation where, in Zanzibar, where people friendly or parents of LGBT were harassed and were put in jail. 20 people, they work in a workshop for parents of LGBT children, that kind of thing. It's legal, right? It's part of the law, that's part of it. So, yeah. On the other hand, we have good experiences. We have, for example, South Africa, which has appalling rates of cases of HIV among sex work. They got together, the government, civil society, and put together a national plan to address the vulnerabilities of sex work that go from violence into no safe place, and not being possible to carry condoms because they would be arrested if they are caught with condoms, because it's proof they're sex work. The government put together with the civil society a national plan to fight HIV among this population. We have the example of Moldova that we brought to the PCB, where you had NGOs working with police enforcement officials, NGOs of drug users, right, to have a better environment to deal with drug use. We have more contentious compulsory detention centers in Asia, but they are showing some progress and so on. So it's not, you look out there, it's not nice. Lots of things are happening that are not good. Mm-hmm. But at the same time, there are seeds and things that are happening that bring hope for the future.
And we need to amplify those stories much more, to do a lot more of what is working and what is and a lot less of what is not working. Yeah. Thank you very much, Mariangela. I liked your point on it's a non-brainer, right, to connect the value added of connecting SDG16 and SDG3. Yet it doesn't always happen, right? And I think that's the challenge, is what does it take for that non-brainer to be mainstreamed? And we could say that for all the goals, couldn't we, as the ambassador of the permanent representative of Mexico was just saying. Alexandrina Iovita, you're advisor on human rights at the Global Fund to fight AIDS, tuberculosis, and malaria. You also have a long-standing experience with UNAIDS and a lot of experience at country level in advising governments on health and rights issues and how they interconnect. I would love to know more about your experience with concrete examples of where both those goals connect, but also to tell us through your experience of guiding governments at country level, what are the challenges that prevent this from happening?
Thank you, Nadia. I was thinking that I'm an example of that intersection myself. I'm a human rights lawyer and also a master of public health. The reason why I went back to school to get that master in public health was because I have felt that us human rights lawyers do not understand the challenges that doctors face in trying to drive good health for people. While doctors very frequently treat patients as passive recipients of care rather than empowered individuals responsible for their own health. I also work for an organization that I think is a very good concrete example of an intersection between Goal 3 and Goal 16. The Global Fund, an innovative partnership of government, civil society, private sector, bringing help where it's needed. Taking not just financing mechanism perspective to driving good health and ending AIDS, TB, and malaria, but also driving that understanding that it is important to address human rights barriers to care in order to amplify the effectiveness of the programs, of health programs. Driving that understanding that what makes our health services effective is when they're not just available, but they're also accessible and acceptable and of good quality so that people can actually enjoy the health services that they deserve and they have a right to. So if we speak about concrete examples of where good, powerful institutions have influenced good health, I was looking the other day at the recent projections published in The Lancet based on the global burden of disease. And if you look at the map of where the projections in terms of meeting the SDG-related health targets look better, look more encouraging, it very much matches with a map where you have strong, powerful institutions that work. And why is that? Because of that no-brainer that both the ambassador and Mariangela were just speaking about how peaceful societies with effective institutions that work, but also with empowered individuals and empowered civil society working together in a truly multi-stakeholder fashion. That actually drives good health. An important element that SDG16 brings to our common plight of driving good health and ending AIDS, TB, malaria, is the element of accountability. If you take a right to health perspective, and if you treat people as active agents of change, be they duty bearers or right holders, the element of accountability, having mechanisms in place for redress to occur, rights are violated, for preventing rights violations in healthcare facilities, for ensuring that those perpetrating abuse are being held accountable. And again, that element of active empowerment and meaningful participation of civil society, meaningful participation of those affected by conditions of ill health. I think the AIDS response has been truly landmark in terms of having meaningful participation, not just a mere principle of human rights, but the real reality of how the efforts to address AIDS have been set out. The vision of zero discrimination as a precondition for achieving zero new infections and zero AIDS deaths has been very much a frontrunner for many other health conditions. I think the world of stakeholders addressing tuberculosis increasingly understand that it takes rights to right wrongs. And it is important to have people affected by the disease, to have people that are facing the disease as active contributors of change, not just passive recipients of directly observed treatment. Mm-hmm. In the world of malaria, well, there are jokes that the only human rights aspect and the only gender aspect of malaria is that the mosquito is a female that transmits malaria. There is great understanding of gender-related barriers to care when a woman is solely responsible for childcare and she has no way of either bringing the children with her or leaving them home to seek health care, when this is a clear and concrete example of when a human rights barrier to services does occur. So it is important that we actually take into account that active empowerment role, and we drive human rights and we drive gender equality as concrete steps towards achievement of better health. In terms of certain challenges that governments face in trying to apply that rights-based lens and approach to care, I think we're so entrenched in the silos that we all represent that sometimes it's difficult for the Minister of Health to see the light and to see if lawyers are not necessarily enemies. And lawyers are not just the ones, documenting violations, but human rights activists and community-based organizations and people affected by ill health are their partners in the plight to have better health for all.
Thank you so much, Alexandrina. also giving examples of malaria, TB, and AIDS. I think that was very, very striking. And I'd like to have more time afterwards to speak about those breaking the silos, right? We all talk about that. It's almost become a mantra, yet it remains one of the major challenges. So why is it not happening, and where does it happen? I think this is really a conversation that we need to have, and not only between 16 and 3. Today we're talking of 16 and 3, but all of you already alluded that, 5 has very much to do with it also, and education also. We'll see if we have time to talk about that later, because I'd also like to have a chance for the audience to talk with the panel. But I'd like to give the floor now to Tuesday. Tuesday, Reitano, you come very much from the talk about silos, right? I'm boxing you into Goal 16. From outside, you very much have more of a Goal 16 background as the Deputy Director of the Global Initiative Against Transnational Organized Crime, an independent think tank based here in Geneva. And a lot of your experience is very much in transnational threats, peace and security. Tell us more about your experience and where those two goals have been non-brainers too, hopefully, or where it hasn't been so obvious. Thank you. Yes, thank you.
Thank you so much, Nina, and thank you for the invitation and to join such an esteemed panel. It really is an honor. We wanted to come here today and talk perhaps a little about some of the issues that Madame Dreifuss had mentioned around the negative impact of the criminalization of drug use, but also perhaps to throw out some other considerations where we see, at least from a Goal 16, but not entirely Goal 16 perspective, how the relationship between health, justice, stability, peace, conflict, and institutions are actually playing out in some diverse environments. So I think that there has been a degree of research and a degree of attention played to the question, the impact of the criminalization of drug use. Arguably not enough, but certainly more than perhaps that we're seeing around higher up levels of illicit economy spectrums. So while a lot of the attention has focused on drug users, the low-level drug dealers, the impacts that you see on people's rights, the criminalization, the overwhelming of criminal justice systems, leading to really very little impact on drug use, drug prevalence, or the conditions of people in their daily lives. Somehow this question around harm reduction, which has become very prevalent at this end of the drug supply chain, if you like, seems to disappear very quickly as you move up the criminal economy chain. So whereas countries with very progressive drug laws that focus very much on the users very quickly move into still very harsh regimes higher up the drug trafficking scale. And one of the questions that we've looked at is, why is that the case? So, if you were wanting to look at organized crime, drug trafficking, organized crime groups, illicit trafficking, criminal groups and gangs, the harms are considerable. The relationships between drug trafficking and violence has been very firmly and consolidatedly proven. Some of the interrelationships between homicides and drug trafficking, the presence of drug gangs in the Americas, organized crime is said to relate to some 30% of all homicide deaths. If you take the city of Cape Town, for example, which has the 10th highest murder rate in the world, ranking up there with the Americas in terms of homicides, it's largely attributed to an enormous amount of violence surrounding drug trafficking in the drug industries in the Cape Flats regions. They're posting numbers of sort of 65 homicides per 100,000, which is extraordinarily high. So one of the questions that we would continually like to ask is, how do you apply this harm reduction lens higher up the supply chain? Other questions, though, I think that it's worth maybe considering from a Goal 16, Goal 3 interlinkage is actually, what is the impact of confidence in your health institutions on the quality of the justice system, on the quality of your state government and institutions? We did a very interesting survey looking at the issue of counterfeit medicines, for example. Counterfeit medicines, some African countries are supposed to see some 80% prevalence of counterfeit or substandard medicines. And we did some surveying in South Sudan over a period of 2 years, and it was very noticeable that people's confidence in the medicines that they were taking directly correlated to their confidence in the political transition. So somehow, how you felt about your own health and the health you had access to was interrelated to how you felt about the confidence of your governance and your institutions. Similarly, when you look at the capacity of the West African countries to respond to the Ebola crisis, for example. Some of the people we interviewed said, well, you know, all the medicines the government that give us are fake anyway, we don't believe them and we don't trust them, so why would we trust their advice when we're responding to a major public health crisis? Another interesting interlinkage, for example, I work a lot on migration and human smuggling. When we talked to human smuggling networks and communities dealing with irregular migration in Libya, they said, well, we don't want the West Africans here because they're all bringing Ebola. And so it's better we lock them up in detention centers and keep them away from us. So, I mean, somehow the interrelationship between your confidence and your viability and your health and the way you perceive your institutions and their integrity is very interesting. I mean, if you were to talk on, I think, the question of other goals, also for us, Goal 5 is very important. The interrelationship between the sort of slippery slope for first-end drug users who were maybe women, introduced, falling through social safety nets, falling into prostitution immediately becoming a gateway into drug use because it's an industry heavily controlled by men who use drug use to keep the women on board. And all of the incredibly negative public health consequences, personal health consequences for the futures of women and girls. So, and we also see there interrelationships between domestic abuse, domestic violence, generational impacts of violence, which then again attack the social cohesion of societies and make the growth of gang cultures and the degradation of society overall interrelated. So, I mean, I think we are very passionately believing in this intersection, even from a Goal 16 criminal justice perspective, that these two are absolutely indivisible. And we would challenge, I think, policymakers to go even further than the harm reduction approach, which is already, I know, a very difficult debate, but to look at this holistically as an all-of-society challenge.
Wonderful. Such powerful examples. They really are striking examples. Thank you very much for having been so concrete. I guess the question is how do you then implement that? How do you land that? And I think that's what so many of us are struggling with. But I'd love to open the floor for the audience to have a chance, if they'd like to ask any questions to the panelists before I continue babbling along and asking more questions. Would anyone like to ask our panelists a question? Yes, please. If you could just introduce yourself very quickly in 2 seconds.
I'm the ambassador and PR of Nigeria in
Wonderful to have you, Ambassador.
Geneva.
Welcome.
And I'm glad to be involved in this process. Am I communicating? Okay, thank you. May I thank the organizers of this event and for the panelists for being here with us. If you go through the concept paper on this event, there is a very key question there which I want to address. The series, I'm talking about what do you call it?
So what?
So what? That the series breaks down what words and paradigms mean in practice. Well, I'm a senior technocrat from my own country, and I've been involved in government programs, projects and projects. Let me raise one practical difficulty, because we must shift, as you said, from words and paradigms to practical realities. If you see the structure of governments globally, let me take my own country, because I'm more conversant with my own country. Budgeting and national planning, these are the two tools used by states to implement programs and projects. Now, if we're talking about the SDGs, we're talking about Goal 3 and Goal 16. Yes, they are indivisible, they are interconnected, agreed. But if you see the style, the approach to government budgeting, they are not interconnected. So if you look at Goal 3, let me give you examples. Goal 3, if I have it, ensure healthy lives and promote well-being. Number one, healthy lives essentially belongs to the Ministry of Health. But well-being goes beyond health. Here, the Ministry for Social Development, the Ministry for Sports, they are all involved. That is on the one hand. On the other hand, if you look at Goal 16, it says promote peaceful and inclusive societies for sustainable development. provide access to justice for all and build effective, accountable, and inclusive institutions at all levels. This is loaded. I have tried to reflect on this, knowing the structure back home in our own country, like Nigeria. I found it difficult to comprehend. Number one, I don't think we have any ministry for peace in any country. So, talking about peace, in my own context, if you're talking about peace, you're talking about policy, you're talking about the functions of the Office of the National Security Advisor. I do not know where the Minister of Health sits down with the Inspector General of Police or the National Security Advisor. Say, look, what we're doing and what I'm doing are interconnected. It doesn't happen. It doesn't happen. What happens is this. I agreed that, like in my own country, before the SDGs, we had an office for the MDGs. And I'm sure this transformed to the SDGs office. What we think should be the case is that as a stakeholder, that particular office should be able to harmonize the views of all ministries, departments, and agencies. But it doesn't happen. It doesn't.
Well, it's a critical point.
So how do we address this? Luckily, we have Madam Dreifuss, who has been the president, maybe been the head of government. She'll be able to tell us, how do you harmonize all these words and paradigms in the practical reality when doing government programs and projects?
Thank you so much, Ambassador. I think, having the voice of countries in this group, in this multi-stakeholder group, is so fundamental. Your voice is precious to really, know from firsthand what it actually means or what the concrete challenges are to land this agenda at country level. And you were really pointing to, the challenges related to budgets. How are we going to revisit or not the way budgets are allocated? How does that whole of government approach work? And what are the drivers? What are the incentives to maybe revisit current architectures? Some countries have revisited all their ministerial architectures, others haven't. Mexico, maybe it would be a good opportunity for you to give us a few points on what drove you to revisit your architecture. There are other in the room that I recognize also. There are former ministers of health also, or other people who may want to take the floor, so to talk about what it means to land this agenda, or any other people, and any other person that'd like to take the floor. Yes.
Hi there. I'm not a minister.
And we're happy to have you.
Not yet. I'm an innovation and creativity expert. In my world, and I also advise companies on how do you do innovation and how do you do creativity, and I'm regularly asked to create the environment in which creativity happens and within which innovation happens. I was recently in Palo Alto running a workshop over there, and I will get to my question in a second. And the leader of the team said to me, I want to create an environment which enables us to change. And I said to him, that won't do it. It's not about the environment. If I had a choice between changing the environment or changing the mindset, I'd always change the mindset. Because an innovative mindset will create an innovative environment. But an innovative environment, if you fill it with people without a creative mindset, will not have the same effect. So isn't part of the problem that when we talk about the Sustainable Development Goals, we focus on the 17 Sustainable Development Goals. We don't focus on the vision behind them. So we start to think about them as separated right from the outset. And I just wondered whether any of the panelists have a particular perspective on that, and whether there is a way to unite that. In my world, we talk a lot about why do you do things? What is the purpose behind it? And we know that we buy into things emotionally and we respond to things intuitively, not intellectually. And yet we seem to have taken what is a fantastic vision for a greater world and turned it into 17 things. And then we discuss these 17 different things, and then we try and find connections between them instead of transcending them and going to the higher level and working at the level of the heart rather than the intellect. So I'd love to hear from any of the panelists their perspective on that, and their perspective on how do you engender that type of mindset, or whether they even think it is about that mindset.
Thank you very much for bringing the notion of mindset, a fundamental one, a systemic mindset, an integrated mindset, which really was at the core of the SDGs when they were created. How do we bring that mindset back into the room and at country level? Fantastic question. David Nabarro. David, you have the floor. And then Mile.
Thank you very much indeed. Just to say that I think what you're doing here today, David Nabarro is my name, and I used to work in New York on these SDGs. But what you're doing today is an example of trying to focus on the principles rather than the goals, because when member states negotiated these goals, they did say that connectedness is key and don't take any of them separately. And I wanted just to say that in my judgment, the power of seeking connectivity is through example. And these panelists are great because they are being precise with examples. My example is when I was working in WHO's emergency division many years ago, and there was an earthquake in Bam in Iran. And I was there, and I was talking to relief workers, and they explained to me how the dealers who were bringing heroin into the community had dropped the price of heroin massively and been selling it to the earthquake survivors, who were really very distressed people, to help them ease their sense of distress, but also to get them addicted. And then it was explained to me the price will then be rising up, and this will provide new markets. And what struck me as I was listening, I said to the relief worker who was explaining this, how come you're into all this? And he said, we talk with the police. We talk with the people who are working on the heroin trade. And because we've got that bridge, we can actually work to deal with what are some very big, difficult situations emerging. I have a few other examples, but I think the only way to do this is through building out from local experience, a bit more difficult in your case, Tuesday, but I think it is possible. And then trying to build a kind of playbook of examples that we can share with others for those who are in situations where it's so much harder to perhaps help break into it. And I was thinking, sir, we've got the good fortune in the UN of having your former Minister of the Environment helping us with some of this. And she's so tough on all of us who've been working with her, saying this only can be done through relationships that are built outside the normal interministerial structures. And that's difficult. It's super difficult in this crossover we're dealing with here. But anyway, that's all I really
Wonderful.
wanted to
Thank you
say.
so much, David, and thank you for being here. All of you will know that Dr. Nabarro is the former special representative of the UN SG Ban Ki-moon on SDGs. So in terms of experience and expertise, it's definitely in the room from all stakeholders. And this is the beauty of this group, it really is. Thanks also for highlighting the power of examples. At the SDG Lab, we really believe in that too, and this is why we want to really dig even more in this role of amplification of examples that are demonstrating impact to really show that it can work. And how can it work, to your point, Ambassador. I'd like to give an opportunity to the panel to react. I know, Madam Dreifuss, you wanted to take the floor, and then any other colleague that would like to take the floor is welcome. Thank you.
Well, thanks to the questions, we have now enlarged also the discussion, and I will come back to the question of coordination or breaking the silos. But I wanted just first to react on the huge duty to control the criminal organization. And we know that drug trafficking is the main source of resources, the main source of income for the criminal organization, which means that it is also the main source for corruption, that it is the main source in money laundering, so that the if it is important to see that the criminal organizations are very flexible, that they can collaborate with, for instance, terrorist organization, let's say for just organizing the traffic from one place to the other, that they have a lot of possibilities, human trafficking, weapon trafficking, and so on and so forth. It is clear that the drug trafficking is perhaps one of the only activities of the criminal organization for which there is an alternative. And the alternative is a regulated market, is a control by the state. And we cannot be naive and think that you could just eliminate the criminal activities also in the drug issue, but you can reduce them massively. And reducing them massively would also weaken, I would say, the criminal organization. So that for us, from the Global Commission on Drug Policy, it is clear that the concept of harm reduction is much more than just a health issue. It's just more than avoiding the situation of people at risk of overdoses or at risk of getting ill from transmissible disease. It is clear that it is also the harm that the criminal organization is doing to the society, and it is huge. I think, Mr. Ambassador, you know better than I do the cost of the power of the criminal organization, and the ambassador from Colombia and others know exactly what it means to fight against criminal organization and how it can change really the life of everybody in society, which are touched by that. So, but the question was more about how to break the silos. Mm-hmm. And I think it's a very important question, and it is also the aim, I would say, of your activity, Nadia. On the governmental level, I think it's very important to go in the direction the ambassador from Mexico showed up. I mean, to have interdepartmental, interministerial platforms that allows really, and at the highest level, at the level of the head of state, or head of government to coordinate the things. But I know also that it is easier to say than to do, and that some ministries can be more powerful than others. But it is really a struggle that is important to bring together the different ministries, to bring also the metrics that they will use to show how they realize the SDGs, and to bring also coordinated and holistic reports to the international scene. But as important, in my view, is to listen to the society, to listen to those who are at the first line, in the first line of being at risk, at being discriminated. And if I can take the example of drug policy in Switzerland, it began really with bringing together all the stakeholders from the state, but also all the NGOs, and giving a voice to the people who were also using drugs, and even to the petty criminals of the chain. I mean, I think somebody said the governments are organized in silos. The society is not organized in silos. The people have their own experience, and their experience is making this link that we are looking for. So listening to the people is the best way, I would say, to break the silos. In drug policy in Switzerland, we had 2 or 3 times huge meetings where everybody was invited. As I said before, the user, the families of the users, the petty dealers, and so on, and they could speak out what were their experience, their lively experience. So I think listening to the people is the best way to overcome.
Thank you.
the
That's a wonderful
silos.
quote, that people don't think and act in silos. I think that's a wonderful new. We need to tweet that. I like
Life
it.
is not a silo.
Absolutely.
Life is bringing everything together.
Thank you. It's very powerful. Yes, Ambassador, could you kindly react to that?
I want
think-
to interconnect the different questions as well,
Please do.
not only the goals.
Please.
The question by my colleague from Nigeria and the statement about the mindset. To me, goal number 3, the end goal of number 3, would be universal access to health. What are the obstacles to universal access to health? You would argue, first and foremost, budget, resources. But it's not the only one. It's discrimination, it's cultural attitudes, it's policies. And this brings the question of mindset. If you don't change the mindset, even if you have the budget and the interconnection between ministries, you won't be able to move on. Look at different countries. Yes, in developing countries, maybe it's a question of resources. But more often than not, it's a question of policies. Look at the biggest country in the world. It is about policies. They are still discussing universal access to healthcare in the wealthiest country in the world. It has nothing to do with the resources. It's to do with the mindset, policies. So unless and until you change the mindset, you won't be able to make progress. I was the one who brought specific examples, and you asked me about that. But I do believe that if we only focus on governmental structures as a way to interconnect, we're missing the bigger picture. That should be the tool, but not the driver. It's to change the mindset. A few words on drug policy. Prohibition, you can argue, is a main obstacle for the full implementation of Goal 16 because of corruption, because of law, rule of law, etc., etc. So when you talk about changing the mindset on drug policy, it's not a purely liberal, abstract perspective because you can do with your body what you want, which I truly subscribe to. For us, for Mexico, it's existential because of what we're looking, because of what we're suffering in terms of violence, because of the fact that half of the population of the US can enjoy drugs for recreational purposes. So what does it mean for a neighboring country? I know that other countries face different challenges, but to sit right at the border of the biggest country where half of the population can enjoy drugs for recreational purposes really poses a challenge that is beyond abstract discussions. It's existential.
Wonderful. Thank you very much. So many things to think about. I think we could continue. We could continue all night. And I'm looking at the time. So I am Swiss, and I did promise we'd finish at 6. But I'm half Welsh also, which means we'll probably finish 10 minutes after because we started 10 minutes before. I know, Mariangela, you need to leave, and I promised you won't miss your flight because of me. So if you'd like to react, I'll give you priority, and then any other interactions are more than welcome for another 10 minutes, and then I'll wrap up. Mariangela.
Thank you. You know, while everybody was talking, I was thinking how, in the context that we have right now, you know, how do we make actually progress on such a progressive agenda as the SDGs are? And then I was, because every year I start the year and I think this is going to be a difficult year, right? Yeah, right? And every year, I guess many of you, so it's a challenging environment, right? And then I was remembering Groucho Marx once, in a joke, he said, you know, someone says, life is difficult. And he said, compared to what? Right? It's actually what, it's compared to last year, to my
Another
life
tweet,
is
by the way.
difficult in different ways than Ruth and people on the ground. But I think one of the things, on top of what was said, which I fully subscribe to as well, I think we need to unpack the complexity. You know, because when things are so big and so difficult. It's difficult to find a thread to unpack it and to make a change. And changes happen in different ways in different countries, like the ambassador was describing, other people are describing. There's change happening every day, positive change. Right? And I think one of the challenge that you have with the SDG Lab and with all of us in the different positions that we occupy now is to make sure that complexity can be broken down,
Right.
and that the good things that are happening out there have a chance to make a wave to make change happen.
We also always say among colleagues in the SDG Lab that we need to contribute to making things more simple but not simplistic. And I think that's a challenge we really have. I saw in the room Ambassador Londoño, you wanted to take the floor from Colombia, former Minister of Health.
Many, many thanks. Thanks to you as the leader of the SDG Lab, to the Global Commission and the panelists. I'd like to go back to the orientation that I think we need to have in every country and at the local, regional, and national level is coherence in terms of policy. And this is something that is all of us have struggled, I think, along our lives. Coherence, evidence-based policies, and third, good communication. And good communication is, of course, it has a big spectrum. But going back to something that is not simple, is not simplistic either, is trying to, when we talk how to connect these two goals, we're going to find out that the health providers are not properly trained to deal with drugs, as they're judges, police, or personnel who are in the other side. Let's say more linked to the justice side or other types of organizations. How we're going to do it, how we're going to really promote better training with not just technical speaking, but also with the humanity, the kind of a different approach to consumers or to potential consumers. It sounds like a kind of poetry, but it's not. It's not, because you cannot put a patient or a consumer in front of a doctor who is trying to take decisions without enough knowledge. Second, you can have someone before the judge taking decisions without understanding the whole path that person is having. But we are not training neither of these people, and even less, we are not training them together. And I think trying to do some training simultaneously to people who are working in the justice sector and people in the health sector could be useful at some point.
Excellent, thank you.
We come from a country that, is
no, I didn't want to interrupt.
producer and consumer. I think, and we have learned that we are not precisely breaking the silos.
Thank you very much for that, and bringing up the notion also of training. That could probably be a useful tool to policy coherence. I'm always struck in Geneva also talking about coherence in I think this is one of the rare forums where different stakeholders from very different silos come together. As a former diplomat, I remember when we talked about human rights and health, all the human rights diplomats used to come. And then when we talked about health and human rights, all the health diplomats would come. But it was never both communities. And that's a challenge. And this is, I think, what we need to continue to do in Geneva, is to nurture this ecosystem, which is breaking the silos in essence. It's the start of a process. Mariangela, do leave if you have to leave. You can just slip away. I won't, I won't be offended. Alexandrina, I saw you wanted to react to some of the points maybe of the audience.
Thank you, Nadia. I wanted to react to another example, concrete example of a country coordination mechanisms that have been established initially to administer the HIV and TB and malaria grants that the Global Fund was giving to the countries. The nice thing about country coordination mechanisms is that it's truly an example of that intersectoral, interministerial processes that you have in country to coordinate a health response. As part of the eligibility criteria for the CCMs, it is important for them to have at least 40% membership of civil society. And not just any civil society, but community-based organizations, representatives of communities that are most affected by the three diseases. It's not every day that you see a Minister of Health that coordinates the CCM, or sometimes even a Deputy Prime Minister that coordinates the CCM, speak to a person that uses drugs, or a man having sex with men, or a sex worker, and understand the implications and the human rights barriers to services that those people face. and that the importance of fostering the communication and a change and a shift in the mindset, so that you actually respectfully listen to your counterpart, and together you come up with an approach, not what the politician thinks works for the person receiving healthcare, but what the beneficiary, what the client, what the right holder, as well as the politician, think together works best for the respective situation or health condition. I also wanted to mention another example of innovative thinking and fostering such a mindset. The Global Fund is currently focusing on 20 countries across a broad variety of regions, epidemic conditions, human rights challenges, with an intensive support effort to promote rights-based approaches to health and to remove the human rights barriers to healthcare. In these 20 countries, we start by doing a deep diagnosis. So what are the human rights barriers to services? And what are the current efforts that need to be extrapolated, that need to be scaled up? Then we start to talk with all the stakeholders, of all the variety of stakeholders that need to be involved in scaling up such a comprehensive response to the human rights barriers to services. We couple that up with strong monitoring and evaluation systems and with creating and fostering that national ownership. So the hope is that this will be a true example of the SDGs, all 17 of them, coming together in practice. Because it is indeed a joint effort focused towards addressing a common set of challenges that requires joint efforts by a broad range of stakeholders.
Thank you very much, Alexandrina. Would anyone else in the audience like to take the floor for a question? Because I'll slowly be wrapping up, but there's still a little bit of time if ever you'd want to ask a question. If not, I'll ask the same to the panelists. If anyone else would like to take the floor, whether I should make a few concluding remarks and maybe see where we take it from here. Yes, I see a hand up, please.
Hello, my name is Biliana and I'm independent. I would like to bring the discussion even at a lower level, and the level is the level of the human beings and each and every one of us, because after all, those goals are supposed to make the lives of all of us better as individuals. So, and what strikes me is that the first word in Goal 16 is peace, and the last word in Goal 3 is well-being. And we know very well that inner peace and well-being of the individual are very well linked. And this has implications on the way we act in our daily life and on the way how we act in the organizations that we live and we work in. So it's not only that we have a possibility for a better well-being at the organizations that we live in, but we also have the chance to implement a different mindset, which the colleague was referring to. So I would like to leave you with a question, and I would like to ask myself also the same question, because I'm noticing that the discourse is mainly how are we changing others. So my question is, how has each and every one of us been brave today in order to bring more peace, more well-being, and more justice to all of us? Thank you.
Thank you very much, Biliana. It's a nice note to finish on. Thank you very much. And I have the difficult task to try to sum up the wealth and richness of this conversation. But I think actually, as hard as it may sound, I think there were quite a few emerging recurrent themes in this conversation. The question then is, what do we do and how do we take it from there? And I'll get there in my concluding remarks. But I think today we clearly demonstrated through this fantastic panel, and thank you again for having come this afternoon, that the links are clear. Some of you mentioned that they were non-brainers, so that they're obvious. There are very fundamental links between SDG3 and SDG16. All our panelists illustrated through very concrete examples the benefits of doing so on the long run for development outcomes, for sustainable development outcomes. I think that was pretty clear. However, the challenge also came out that although that may be clear, and there are a lot of examples that were mentioned here, we lack this critical mass of examples. This was the point of David's, right? A critical mass of examples to really illustrate the point and help, to the point of Mariangela, to help simplify this narrative and demonstrate that it is possible in practice. It is not just a theoretical, complicated narrative of a bunch of diplomats that agreed on this in New York. And by the way, it was much more than just governments, right? it was multi-stakeholder. But I think this point is critical, the critical mass of examples. And we commit at the SDG Lab to really work on this point of gathering those examples, and not only the ones that have worked, but also the ones that haven't worked and why they haven't worked. What were the ingredients of success and what were the ingredients of failure, so to speak, and how can we address those ingredients so that they become successful. The other point, the ambassador of Nigeria, which was then, many of you mentioned that also, that a whole of government approach doesn't just happen like that. There are huge issues to be taken into consideration, not least budget issues. And it's, what is political will? Political will won't just happen like that if there's not an understanding of what the benefits are to think and act and invest differently, right? And we come back to those examples. To be able to convince people of acting differently, they need to see good examples. Also, I think a lot of the examples put people at the center, the role of citizens in driving this agenda, that revisiting the way we do business will also happen with the support of citizens because, as Ruth Dreifuss was saying, people don't think and act in silos. When you're a mother, for example, you think of health, but you want to make sure that your kids are healthy, but there's the right food in the fridge, and you want to make sure you have a job, and all these different things are all in one person, right? You can't divide a person in 17 different silos, and I thought that was pretty powerful. Anyway, I think I would just like now to suggest a few things in terms of what we can humbly do at the SDG Lab and what we can do as a Geneva ecosystem to move this forward. We are convinced, and DG Muller definitely is. He wanted to be here today. Unfortunately, he couldn't come. But he's a strong advocate also of the energy that we have in this city to think and act in an integrated place, in an integrated way. And I'm not saying that versus other cities or other hubs. I'm just saying this is one of the huge beauties of this city, and we need to capitalize even more on that. So in terms of the SDG Lab, what's next? First of all, just to tell you that we've launched today the SDG Lab newsletter, which will be Kaylee, every 2 months probably, we'll be updating you. If need be, we'll be agile and flexible and update you more regularly if there's a will to do so. You've all received it. If you haven't, make sure that you share your card with our team so that we have you on our mailing list. It's gone to all missions also so that you know what we're doing and what our thinking is. Please note also that we are growing and developing thanks to your feedback. It's really at the core of our work. We want to have that agile characteristic that we're able to change if we see that we're barking up the wrong tree. If we see, for example, that these so what events are not useful, or that they are, but they could be tailored in such a way to be even more useful, we want to hear that. So please get back to us. You can either use our website, or you can use Twitter, or you can use our email address to make any concrete suggestions on how we could do that. A few more things on the SDG Lab upcoming events, so to speak. We just recently had a very interesting debrief with the entire Geneva ecosystem on what came out of the high-level political forum in New York in July, breaking down what were the recurrent themes that member states highlighted. And no surprise, a key one was a whole-of-government approach doesn't just happen. How do we make that work? That was really at the core of the HLPF. We'll be having a similar happening, so to speak, geared more specifically towards member states, where we want to bring those themes that came out of the HLPF and say, okay, what are we going to do now with these trends? So what? We had great national reviews that were presented in New York. A lot of work was put by all these countries to do so. We need to go further in terms of sharing lessons of successful examples. In November, this we still don't know, and this we'd love to have in your feedback also, is we realize that there's a strong appetite to share. So we call this the Dare to Share. In what form it will take, we still don't know, because we don't want to fall in the trap of being event organizers, because there is enough events in Geneva. But we see that a lot of stakeholders have experiences to share and want to learn from others. But we need to do so in a focused way. So what we were thinking of doing is that the so what events, where we cross two goals, then lead to a format, which is to be defined, where stakeholders will have an opportunity to share their experiences in crossing both those goals. So say in this room, if some of you haven't had a chance to share with others all the great work you've done or questions or experiences you have in crossing those two goals, you would have in this, whatever format will take happening, the opportunity to do so. For those who are part of also the Geneva ecosystem, we'll have a meeting in November where we will be nudging you or challenging you or seeing whether you're ready to jump with us to say, let's experiment and try to bring the Geneva ecosystem together around a few targets. So make a choice. There are 169 targets. Geneva as an ecosystem doesn't have DNA, so to speak, on each and one of the targets. But on many of those targets, it does. And can we experiment together? What kind of result, what comes out of an equation when we all get together from all our different entry points? For example, addressing increase in internet coverage through entry points not only of WIPO and ITU, but from maybe even the Global Commission on Drug Policy, or WHO, or the Global Fund, or UNAIDS. This we'll be discussing in the ecosystem meeting. And then in December, we'll have the next So What series. If your feedback shows that these events are useful, we will hold another one. There's already an organization ready to host us, where we'll be crossing sanitation, SDG 6, and inequality, SDG 10, in the spirit of trying to simplify this concept of indivisibility. How to share at this point, as I said, we're still looking into the best format to dare to share. But the avenues we've already got in place, or the tools we have in place to date, are the following. You can share directly on our website through the link that is here, any experiences, or even if they're not fully fledged, mature ideas, it's fine, just share them there. And we would then take them up and see how we can connect you to other people to maybe bring that idea or that experience further. The SDG studio, I mentioned it, Ambassador said it would be great to interview you, for example, on the whole of government approach in the Mexican government. It's a small room that we've launched at the beginning of the year with cameras and mics, where we like to ask unexpected questions. And we would be looking at, such as, how did you manage to do this? This is one tool. The other one is our email. Just drop us an email with any ideas, suggestions. And obviously our Twitter account. Tell us also what you think. There are papers circulating here in the room if you like to write down things. In the spirit of the SDGs, we only printed a few because we thought it's not very respectful of the environment. But some of us still like to work on paper, so the sheets are out there. Or you can do it directly on our website. As you come out, a few of my colleagues, actually, I'd like the SDG Lab team to stand up, because it's not just me. You may want to stand up, and as you come out of the room, they will be suggesting just to take a quick soundbite from you on their iPhones on, what was the unexpected question or answer you got in this event. And if you'd like to engage in that experience, it would be great to have a few soundbites that we would then put on our website. I think that brings me to an end. I know this brings me to an end. Unless there's any burning questions or comments out there, I'd like to thank first and foremost our fantastic panelists. I have personally learned a lot. Thank you very much. And I'd like to thank all of you, the Geneva ecosystem, for having come today. It is really precious to have this group in Geneva, and we, as the SDG Lab, want to contribute to nurture this dynamic, and you can count on us to do so. Thank you very much. Have a good evening.
Merci beaucoup, Nadia.
Merci.
Super. C'est intéressant, hein, ah oui.
J'espère.
Thank you very much.
Thank you, Ambassador. Wonderful.
Thank you. Non, vraiment. Bravo.
Different perspective from what I usually take. So it was fascinating. Thank you so much for coming.
Yeah, that was really good. You're an excellent moderator. Thank you. Sorry? Super to learn about your situation. It would be, what was so new? It's Lomónaco. great to meet you bilaterally. Yes, I'll give you my card.
Looked at how organised crime is across those
Oh, good.
and are now actually working on an SDG organised crime in Africa.
And how it
Policy.
we can give voice to your report.
Esta semana no para hablar y sí, perfectísimo. Tu secretario puede llamar. Estupendo. Sí, ok. Gracias. Bueno. Nos vemos. Chao.
No, demasiado lejos de todo.
Oui, 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 elles ont été respectées.
I'm not. I found out about it.
Dans le communiqué, j'ai un peu réussi le langage plutôt que call for. Nous appelons à ce que des gens prennent l'initiative. Oui, oui. Non, l'idée là, c'était très bien.
Very lovely to meet you. Listening to your words and the humility with which you spoke.
Thank you so much. I'm Julia.
Basically dedicated to Voilà, c'est exactement. Again, I was also with
Oh, you were there.
Voilà,
Okay, or I can check one closer to me, check the one closer to you. Right. Panelists, friends, and then we're trying to we basically do have things to tell.
Merci pour votre travail, for your access to medicines work as well as for this one. And access to medicines is still very important. Not enough has been done. When I was involved in receiving that report, and I just read the Oxfam thing that was produced at the weekend, complaining that insufficient action has been taken. And I'm glad that Oxfam is stirring the pot. On access to medicine. I think I read that. Yeah, I saw it. J'ai quitté Nations Unies, mais je suis à votre service. C'est de commencer une petite fondation ici en Suisse pour le petit développement durable. Félicitations.
Oui, je voulais juste serrer la main parce que vous m'avez dit que j'étais une amie de Julien Feder. Mon amie de Charlotte, qu'elle est soutien.
C'est courageux parce que parfois, face à un drame pareil, c'est difficile de dire c'est immense.
En tout cas, merci.
Non, c'est pas en mettant des fois et moins Spenza, on va travailler.
You are Michael Hans wife.
And then when they said unionized, I'm like, I know. The window in the human rights, human rights office.
So I work independently. On one side I'm an artist, so I work in locations all over the world, and on the other side I advise leaders, teams, and organizations how to create essentially. What is creation? How do you create? And how do you not just create, but how do you realize that creation? So how do you turn it from an idea in the head into something tangible outside? Every single organisation, and in fact everything we do, ultimately is about creating. Right? And you could say the problem today that when we create, we are analyzing ourselves. So what we do is we project our lack of alignment onto something outside of us. We blame the system, we blame the environment. Whereas ultimately where we ended up was it's not about what's outside, it's about what's inside. What's inside creates what's outside, right? So if you are, take a really specific example, take Uber. Actually, Uber was supposed to have a massive impact on sustainability.